Hello, I'm Dr. Praveen Ravishankaran, a robotic cancer surgeon with special interest in advanced minimally invasive cancer care. Over the years, I've had the privilege of treating patients across a wide spectrum of cancers using cutting-edge technologies like laparoscopy and robotic surgery. My work is focused not just on removing cancer, but on doing it with precision, minimal pain, faster recovery, and better quality of life for my patients. Every surgery I perform is a balance between science, technology, and compassion, because behind every diagnosis is a person, a family, and a story. Through this platform, The Wellness Oracle, my goal is to simplify complex cancer care and bring clarity, awareness, and confidence to people who need it the most. Today, I want to talk about the most commonly diagnosed cancer in men globally, and the cancer where a single inexpensive blood test has already saved thousands of lives, including one of the Hollywood's most famous, prostate cancer. But first, let me show you something extraordinary with 3 items: a clear plastic bottle or a tumbler, water, and a laser pointer. Fill the bottle with water and pierce a small hole near the bottom. Let the water flow out in a thin curved jet. Now shine the laser pointer directly into the bottle from the opposite side, aimed precisely at the flowing water stream. Watch what happens. The laser light bends. It follows the curve of the water traveling inside the stream, around the corner, all the way to where the jet hits the surface below. It travels invisibly inside the water, contained by the difference between the water and the air around it, bouncing off the inner wall in a process called total internal reflection. The light is there, powerful, present, traveling, but completely invisible from the outside unless you know exactly where and how to look for. Hold on to that thought. In October 2016, Ben Stiller, one of Hollywood's most recognizable faces, the man behind Night at the Museum, all of us have seen that, quietly broke 2 years of silence and told the world something that stunned everyone who heard it. He had been diagnosed with moderately aggressive prostate cancer in 2014. He was only 48 years old. He had no symptoms, no pain, no urinary complaints, nothing. A routine PSA test, which his thoughtful physician had started giving him at the age of 46, showed rising levels over 18 months. An MRI followed, then a biopsy, and then the diagnosis led to surgery, a robotic prostatectomy that removed the cancer completely. By September 17, 2014, just 3 months after the diagnosis, he was cancer-free. He went public 2 years later with a single unforgettable line in a widely read essay: "Taking the PSA test saved my life." And then he added the details that should stop every man watching this in his tracks. "If I had waited, as the American Cancer Society guidelines suggested at the time, until I was 50 to start screening, my cancer would not have been detected for 2 more years. I would not have known that I had a growing tumor until after I was already being treated." Stiller is today healthy, cancer-free, and one of the most passionate advocates of prostate cancer screening all over the world. Prostate is a small, walnut-sized gland that sits just below the bladder in men, surrounding the urethra, the tube that carries urine outside the body. Its primary job is to produce fluid that nourishes and transports the sperms. When cancer develops there, it is almost always an adenocarcinoma arising from the glandular cells of the prostate. Prostate cancer tends to be slow growing in many cases, but certain aggressive variants can spread quickly to the lymph nodes, bones, and other organs if not caught in time. Now, let's look at the numbers. Globally, prostate cancer is the second most commonly diagnosed cancer in men and the 5th leading cause of cancer-related deaths in males worldwide, with over 1.47 million new cases and nearly 4 lakh deaths in 2022 alone. In India, it has climbed from the 11th most common male cancer in 1990 to the 3rd most common cancer today, a dramatic shift in just 3 decades. According to the National Cancer Registry program, prostate cancer now accounts for over 6% of all male cancers in India. Risk factors include increasing age. The disease is rare under 50, but the risk rises sharply after 60 years. A family history of prostate cancer, particularly in a first-degree male relative, roughly doubles the risk. Certain inherited gene mutations, including BRCA2, also increases susceptibility. In India, rapid urbanization, high-fat diet, sedentary lifestyle, and rising obesity are increasingly recognized contributors. As I said, early prostate cancer almost never causes symptoms. As it progresses, men may notice difficulty to start urination, a weak or interrupted stream, frequent urination especially at night, blood in urine or semen, or pain in the bones or lower back in advanced diseases. But I tell every man over 50 who walks into my clinic the same thing. Don't wait for symptoms. By the time they appear, the window of easiest cure may have already been passed. So screening is very important. Screening rests on two primary tools. First is PSA test or prostate specific antigen, a simple blood test measuring a protein produced by the prostate cells, both normal and cancerous. Next is a digital rectal examination or DRE, where the doctor gently examines the prostate through the rectum to feel for any changes in size, shape, or texture. We then use an MRI of the prostate, which gives us a detailed anatomical map of the gland, highlighting any suspicious area with extraordinary precision. We then perform a targeted, image-guided biopsy of that specific area. Treatment of prostate cancer is not one size fits all. For very low risk, slow growing cancers, particularly in older men who have a lot of comorbids, active surveillance is a legitimate and evidence-based approach. For localized cancers with curative intent, the two main options are surgery and radiation therapy. Both are highly effective for appropriately selected patients. For advanced diseases, where the cancer is spread to the lymph nodes or bones, hormonal therapy, which reduces testosterone levels to starve the cancers of its primary fuel, is the backbone of treatment. This is often combined with newer generation anti-androgen agents like enzalutamide or abiraterone, and in aggressive diseases where chemotherapy like docetaxel is also used. And this is where I want to speak about something I am very passionate about: robotic radical prostatectomy. The prostate sits in one of the most anatomically complex spaces in the body. In front is the pubic bone and the bladder, behind the rectum, below the pelvic floor, and on either side, running intimately along the sides of the prostate, the neurovascular bundle, two delicate ribbons of nerve fibers responsible for urinary continence and erectile function. Preserving them is very important. Robotic surgery is the answer. We operate through small keyhole incisions, working with instruments that have 7 degrees of freedom, far greater than that of the human wrist can achieve in such confined spaces. The robotic system gives me a high-definition magnified 3D view of the entire operative field deep in the pelvis. The neurovascular bundle can be seen with clarity that open surgery can never provide. The result is complete cancer removal with a significant higher rate of preserved urinary continence and erectile function compared to that of the open surgery. This is not just surgery. This is surgery refined to its most precise form. Now coming back to our laser and water jet. That light was traveling through the stream the entire time, present, powerful, moving, but entirely invisible from outside. This is by the process called total internal reflection. Prostate cancer is exactly this. The cancer is there, growing inside the gland, building inside the capsule, present and active, while the man who carries it has no idea, because there is no external signs, no pain, no symptoms, no visible change. The PSA test is that laser. Aimed precisely at the right moment, at the right age, it illuminates what is happening inside. So I urge you, if you're a man over 50 or over 40 with a family history, please talk to your doctor about PSA screening at your next visit. If you have a man in your life who fits that description, a father, a brother, a husband, or a friend, please share this video with them. Men do not share health content that easily. Be the exception that saves someone's lives. Subscribe to the Wellness Oracle for more clear, practical, and evidence-based insights into cancer care. Stay informed, stay strong, and I'll see you in the next video where we continue this journey of understanding and fighting cancer together. Thank you and have a nice day ahead.